Hi everyone, it's Dr. Krad. Many of you have requested that I make a video shedding light on the financials related to cataract surgery. How much does cataract surgery cost? Which lenses are covered? Which lenses are not covered? Is laser cataract surgery covered by insurance? All great questions. Clearly, there needs to be more transparency. I may make multiple videos on this topic because there's so much to cover, so make sure you subscribe so that you don't miss other parts of this series. First thing we need to go over is what is a cataract and what does health insurance cover? We are all born with a lens inside our eye. It helps us see. But as we get older, that lens becomes stiff and cloudy. That cloudy lens is called a cataract. If the cataract is visually significant, your health insurance will cover cataract surgery. During cataract surgery, your ophthalmologist will replace your cloudy lens with a new, clear, artificial lens. In the United States, it's your regular health insurance plan that would cover cataract surgery, not your vision plan, which is usually to cover glasses or contact lenses. A cataract affects the health of your eye, so regular health insurance will cover cataract surgery as long as the cataract is visually significant. It doesn't matter if you have a PPO, HMO, or Medicare, you don't need a separate vision plan for cataract surgery. Keep in mind, if your cataract is not considered visually significant, then no health insurance will cover your cataract surgery. What does visually significant mean? The natural human lens doesn't become a cataract overnight. Cataracts usually progress gradually. It's like getting gray hair. And so at what point are they considered visually significant? How is that defined by your health insurance? The answer can be quite nuanced, but putting it simply, if you can see well either with or without glasses, then your cataract is likely not visually significant. For cataracts to be visually significant, it essentially means that you are not seeing well enough to perform activities within your daily life, such as driving, reading street signs, reading your phone or your book, and that glasses don't or wouldn't help. Perhaps you have severe glare while driving at night. If your day-to-day visual tasks are difficult without glasses, but clear with glasses, then that's not enough to qualify as visually significant because glasses can fix the problem. You don't need surgery. Insurance doesn't mind that you may need glasses. Even if you didn't need glasses for your entire life and all of a sudden you need glasses, glasses are cheaper than surgery. Insurance would rather cover a pair of glasses for you than to pay for your surgery. You may need a separate vision plan for glasses coverage, but some health insurances will cover glasses for you. So in general, if you can see well with glasses, then your cataracts are unlikely to be visually significant per your insurance. Some of my patients have pointed out that since they will need cataract surgery sooner or later, why don't health insurances just cover it and get it over with? Even if it's mild, let's call it preventative care. The answer is that they want to kick the can down the road for as long as possible. Sure, maybe you will need cataract surgery in a year or two, but you may have a different insurance company, a different insurance plan at that time. Every year in the United States, people can change their health insurance plan. So why would your current insurance company want to pay for a treatment now when a different insurance company can pay for it later? Sometimes a patient will ask me, can't you just say I need it as my doctor and get my insurance to cover the surgery? Well, could I or would I? I have two different answers. I could, but if I did that, it would be fraud. And so the answer is no. We need to be honest. Now, if you have real visual symptoms, we will document that in your chart to justify your potential treatment. But we can't make anything up. Even when an insurance agent approves your surgery beforehand, they sometimes come back in a year or two with an audit, and things will get ugly if any fraud was committed. So stick to being honest. Let your doctor know about any visual symptoms you are experiencing. Now, let's say you do have a visually significant cataract. What parts of the cataract surgery does the insurance cover? While your health insurance plan is giving you access to care, the ultimate goal of your health insurance company is to make a profit. So they want to spend as little money as possible for your treatment. They will usually cover cataract removal, a facility fee, anesthesia, and post-operative visits within 90 days after your procedure. You will be responsible for any copays or deductibles depending on your plan. These copays and deductibles apply for your surgeon's office, like the surgeon fee, and the surgery facility and your anesthesia provider. Insurance doesn't pay for optional lens implant upgrades or for the use of laser during your cataract surgery. They don't pay for anything beyond the basic requirements of cataract surgery. No extra measurements, no extra diagnostics, no astigmatism reduction, no advanced lens implants, no laser during cataract surgery. They just want us to get the cataract out and put a basic monofocal lens in. That's it. Remember, the insurance is trying to spend as little money as possible. This applies to all health insurances. Patients have even asked me to write letters to their insurance saying that an optional advanced lens implant was required. That wouldn't be truthful, but even if your doctor lied to them and said that the multifocal lens or the light adjustable lens is required, they will say, sure, put it in if you want, but they will only pay for the basic monofocal lens. Think of it this way. Let's say you have auto insurance for your car, and unfortunately you got in a car accident. Now your car needs to be repaired for a week, and your auto insurance provides rental car coverage of $30 per day. So you're going to get a rental for a week. You go to Enterprise to rent a car, and they have a few options for you within the $30 per day coverage. A Kia, a Hyundai, a Toyota Corolla, these are examples. Now they also have a Corvette available for $300 a day. They have a Ferrari, a Rolls Royce for $500 per day. No matter how much you want the Ferrari or Rolls Royce, your insurance will not pay for them. And there's no way Enterprise, the rental car company, will give you the Ferrari when they're receiving a cap of $30 a day from your insurance for your rental. Now, everyone has a personal budget. If your budget is $30 a day, that's fine. Take the basic car. Yes, you will likely be more reliant on glasses, but your cataract will be gone. Job complete. Your insurance will cover $30 a day to put you in a vehicle that can get you from point A to point B. And the basic cars will do that just fine. That's very similar to a basic monofocal lens. However, the Ferrari and the Rolls Royce are considered luxury or deluxe items. They are not necessary to get you from point A to point B. Similarly, your insurance will not cover toric lenses, multifocal lenses, light adjustable lenses, EDOF lenses, or the laser for cataract surgery. That's because they are not required to remove your cataract. Your surgeon is trained to do cataract surgery by hand, and they can put in a basic monofocal lens, which can take you from point A to point B perfectly well. A monofocal lens with the appropriate glasses can provide excellent vision. I hope this is making sense. Now, why does it cost thousands of dollars to upgrade a lens? There are many factors that led to high costs associated with lenses and laser upgrades. I will dive deep into that in a future video. I hope you found this video helpful. I'll catch you on the next one. Peace.